dear viewers, raising mental health awareness can help you understand your symptoms, find professional treatment, and most importantly, break the mental health stigma that leaves so many people to suffer in secret. We have been joined by Dr. Mohammed Alsuwaidan, consultant psychiatrist and founder and clinical director of Mindwell, and Dr. Abdullah Habib, doctor of psychiatry and director of clinical neuropsychology at Mindwell. Good evening, Dr. Mohammed and Dr. Abdullah.
Hello, how are you?
Hi, thanks for having us.
Thank you so much. It's my pleasure to have you both with me this evening. We have so much to talk about, and Dr. Mohammed, in the beginning, let's start with the basics outright. What is mental illness, and what causes it?
So mental illness is a very broad concept, but if we go to the basics, just like any other illness in the body, mental illness is an illness of an organ, and the organ is the brain.
Yes.
So the brain has 5 main functions. 2 of those functions have to do with our field, psychiatry and psychology, and that is emotions, cognition, and in fact behavior as well, overlaps. Neurologists deal with movement and with sensation. So mental illnesses involve illnesses that involve your mood, your behavior, your thinking. They can be things like depression, anxiety. What causes them is very, very complex. What we know about what causes mental illness is that there seems to be a genetic component, an environmental component. And there's a model we call the stress diathesis model. And what we mean by that is someone has a diathesis, which is a fancy term for a vulnerability to developing mental illness. And then at a certain point in their life, whether in childhood or later on in life, they'll undergo a stressful event, childhood trauma, or a financial loss or loss of a loved one or bullying. And then that will make the vulnerability that's genetic emerge into an illness. That's the best models we have around mental illness today.
That's right. I think most of us think that it's just the environmental factors, which are bullying or maybe just going through something really harsh in our childhood, but way more goes with it, Dr. Abdullah, that's right?
Yeah, and I think if we look back into everything we've been saying the previous weeks is there's a big biological factor that comes into mental illnesses. Environment plays a huge part of how we develop resilience to a lot of the stressors we go through in everyday life. But a predisposition to these stressors is what makes us develop potential mental illnesses. And that's the differentiating factor between somebody that eventually does develop a mental health condition versus someone that doesn't in the long term, is the predisposition of having that.
It can also explain why mental illnesses can come and go. For example, someone with depression, as we often see, will have recurrent depressions. And sometimes the depression will be okay, maybe it's settled with therapy or medications or both, and they'll be fine for years. And then another stressor will happen, which will cause another depression to happen. So the vulnerability is always there, genetically. But then it could be under control through a good lifestyle and maybe a period of time of taking some treatment. And then it can come back again, just like an asthmatic. If they're in a sandstorm, they'll have an asthma attack.
That's true.
So someone who has the vulnerability, maybe under, not a sandstorm, but environmental stressors, the depression or the anxiety will emerge.
That's right, Dr. Mohammed. I think we always notice that patients or people dealing with mental health issues, especially depression, you do see them going in and out of it over time. So that's completely normal, I'm understanding.
In some mental conditions. I mean, there are other mental conditions that we deal with that are more chronic, that are there the whole time.
It's a lifelong condition rather than it being something that you treat for a certain amount of time, and then we see some of the symptoms slowly start to be controlled. Because in mental health, we tend not to have anything known as a cure for mental health condition. We always control the symptoms to a point that the person can live a successful life without these symptoms affecting their everyday functioning in terms of their academic performance, their social life, their work, or any aspect. But we never really just purely, the term cure used even in our field. But there's some conditions that even when we come to control them, we have to keep controlling them for life rather than for a certain period of time, and then we stop our intervention, whether it's psychological, whether it's biological. We stop it for a time, and then we hope that we did a very good job controlling them and that they don't get these symptoms going back. But of course, there's chronic symptoms that are a lifelong condition and we have to maintain throughout this condition.
This is something severe, for example, like schizophrenia. That's a chronic mental health, or autism, or
bipolar.
But bipolar tends to come and go by the nature of the illness. Even sometimes without treating. I mean, but something like Alzheimer's. Alzheimer's is a chronically progressive illness of old age that involves cognition, your memory and your thinking. But a lot of people don't realize it involves other parts of the brain, like mood and behavior.
Yes.
Yeah.
So that's completely normal. So it's not like breaking a leg where you get a cast, it's off and that's over. You need to forget about that. It's something that you do need to follow up on all the time and just make sure that you're mentally fine and taking care of yourself. So Dr. Abdullah, I think a big issue for a lot of people is finding the right mental health care professional. So we don't know, should we go to a psychiatrist, a psychologist? A lot of us don't know the difference. Can you tell us about the different professionals out there?
Sure. So I'll focus on one aspect because it's a large, it's a big question, even though it might seem simple, but it's a very big question. So when we look into the field of psychology, there's different sectors within and fields within the field of psychology, subspecialties and categories where people choose what they want to do. So we have, I would say you can break them down into three main aspects. The first one would be academia, where a person is a professor, an academic, they teach at universities, they do research, and these people tend to not see patients. They don't interact with patients. They're the people that are making or developing or working on research that clinicians base a lot of their work on, is based on the academics. And then we would have another category which would be called like consumer psychologists, which they're people that work in marketing and the people that tell you, for example, the old kind of thought of $9.99.
Right.
It's easier to buy $9.99 than 10. And that's based on this kind of marketing, consumer psychology aspect of what you see. Having things, for example, I don't know if you ever saw any of the restaurants, they would say limited edition or limited time only, and then you'd see that same thing coming back next year, even though it was limited.
And we know it's coming back, we're waiting for it.
But that limited thing makes you want to go back again, and that's also what we tend to see in marketing psychology or consumer psychology. And then we would have the aspects of clinical and counseling psychology, and this group is what works with patients, and they have patient care. And in this category, there's two main aspects. There's the counseling psychologist, and this is people that specialized in talk therapy. And this is a part of their mental health treatment, is where they spend time and they talk about their condition, their problems, their worries, and how to reconstruct some of the difficulties they have. Originally, how it even started, therapy, is based on a long time ago. They found that patients, when they started talking about their condition, they tend to see them improving, and that's how therapy even began as a concept. Is by patients just talking about how they feel, they saw that their symptoms got better. So that's what the job of a counseling psychologist would do. And then you would have the clinical psychologist. The clinical psychologist, what we would think about it, is the closest thing to a psychiatrist, but with kind of a huge differentiating factor of how they got their training. But they're the closest to a psychiatrist. Their work is in diagnosis, their work is in evaluation. They would do sometimes a lot of work in terms of neuroimaging, such as looking at brain scans, looking how the medication affects the brain, and other aspects such as even as new therapeutic approaches, such as something known as brain stimulation, which is an alternative kind of procedure as a biological intervention, but it's not using medication. And we treat, it's a treatment, an alternative to medication, as a first line to it. And this is something they would also work in. And then of course you would have the psychiatrist in that field. And so I guess
so I mean,
more about that.
So, Dr. Abdullah trained in clinical psychology, but uniquely has a doctorate in psychiatry. We work very closely together. So it's actually a good example of how a clinical psychologist and a psychiatrist work together. So for psychiatry, psychiatrists are medical doctors through and through. The origins of psychiatry, the earliest psychiatrists like Freud were all neurologists. They trained as neurologists. And then it was discovered that there's this other aspect of the brain that we're not treating. There's patients that have paralysis that doesn't make sense. It doesn't fit with the tracts of the brain. And that's how psychiatry originally emerged. So it's a brain specialty within medicine. So a psychiatrist studies medical school, medicine, surgery, obstetrics and gynecology, pediatrics. So I've done all of that. You work as an intern, and then you choose to specialize in psychiatry. So psychiatry is very focused on the biological aspects of the brain and using treatments such as medications and making a medically informed diagnosis. When a psychiatrist and a clinical psychologist work together, I think that's the best care a patient can get, because you're getting both paradigms of looking at the patient's condition, the diagnosis from a very medical aspect, and then the diagnosis from a more grounded theoretical framework of psychology, and then coming together with an action plan where there's a lot of overlap. Unfortunately, one of the things we see is that the lines are blurred, and because patients and society doesn't really understand the difference, and I think this is why this is such a good question.
That's true.
They don't do their research, and then you can end up seeing someone who claims to be doing something, but they're not actually qualified. They don't have the correct licenses to actually practice in that field.
That's true, because I think a lot of people don't know the difference, and when they differentiate, they think that a psychiatrist gives me a medication, and then a clinical psychologist talks to me. And there's definitely way more to it. Exactly. We don't know the ins and outs of it. I was literally going to ask you before you mentioned this. So, does it happen often that both of you work together, where a patient would, let's say, need a psychiatrist and a clinical psychologist, or usually is it just specific cases that would need both types of care?
That's a very good question. I think at least the way we work and the way I was taught to work, and I think the way Dr. Abdullah was taught to work in the centers we trained in, it was a very collaborative approach.
Nice.
Because that's how patients get better care. There's a term in medicine called multidisciplinary care, MDC, multidisciplinary care, where someone will see a doctor, a physiotherapist, a chaplain, a nurse, a pharmacist, and then doctors from multiple specialties. Well, we need multidisciplinary care within mental health, and I think that's really important. At least the way I think both of us were trained and the way we work now, we discuss patients literally every day, especially patients that are very complex. And oftentimes, Dr. Abdullah will kind of make me think of a way I didn't think about it, because I'm coming from the very medical paradigm. And then maybe Dr. Abdullah will mention something, and I'll say, but it could be, it could be this thyroid illness, or it could be this, where it's something I've trained in early on in medicine. So I think it's a very good model for working together. And I think most patients would get better care going to a place where psychiatrists and psychologists work in the same place.
Yeah, I think it's a very beneficial way of treating patients, because even sometimes the patient wouldn't realize they need to see the other person.
That's true.
The amount of patients we see that say, I just want therapy, and they actually need meds, or a person that says, I just need meds, and they would need therapy at the same time, is substantial. It's on a daily basis, and it makes it easier for us to provide that care once both these services are under the same roof, because all I have to tell them is, you just have to go down the hall. You don't have to go somewhere else completely, and they're more likely to go down the hall than to go to complete different center. And you tend to, a person that doesn't even want therapy or tends to not wanting medication, after some time you spend with them and they end up taking that path as well, they come back to you and say, and it's never somebody that comes back to you and says, well, you recommended therapy and I never needed it, or you recommended medication and it didn't help me. It's always they think, thank God you actually recommended that and you were able to provide that for us.
And it goes a little, I mean, even beyond that, because it's not just the medications and therapy. For example, sometimes I'll be stuck with a diagnosis and I'll turn to Dr. Abdullah and say, I think this guy, I would get a better view if I had some testing. Now, psychologists are the experts in testing, and actually psychometric, IQ test, personality test, ADHD testing, autism testing, and so on. And sometimes even the testing is not clear. So Dr. Abdullah will come back and say, here's what the test indicates. What did you see clinically? And then we put that together. For example, we want to do a brain stimulation for someone. And so in terms of neuroanatomy, neurophysiology, both of us studied it, maybe me more from the medical aspect, but from the theoretical framework of brain stimulation, Dr. Abdullah studied it more. And so collaborating on a case like that, the patient's going to get much better care than either one working alone. It's a case of synergy, I think, not just me and Dr. Abdullah, I mean psychiatrists, psychologists working together, where 1 + 1 = more than 2.
I think that's where the patient really gets the full circle, the best of both worlds on both sides. And I understand where you're coming from, Dr. Abdullah, when you mentioned the patient not wanting to talk or not wanting medication, because we might know we have an issue, but we don't know what we need. That's why we're seeing professionals. So Dr. Muhammad, if a patient thinks that they're dealing with a mental health issue, what's the first step they should take? I think that's where most of us get lost.
Right. In terms of who to see or what to do?
What to do, who to see, do I go straight to a doctor, what's the plan?
Okay, so I mean the first thing is to know what are the signs that you need to see someone. And the easiest sign is to think about your functioning in life in 3 major areas. Dr. Abdullah actually mentioned them earlier: your academics, your occupation, and your social life. If you're having a problem, whether that involves behavior, attention, cognition, mood, and it starts to affect one of those aspects of your life where you can't do one of those aspects of your life, or you're doing them with much difficulty, then it's time to see someone.
Right.
Now, do you see a psychiatrist or a psychologist? Honestly, if you're seeing someone qualified, it really doesn't matter, because if you see a psychologist and you really need a psychiatrist, they're going to direct you, and vice versa. I would be very careful of seeing someone who's not qualified. And the way you would know that they're not qualified is, for example, someone who works in another area of medicine but has an interest in psychiatry.
Yes.
That's not enough. I mean, if I had an interest in pediatrics, that doesn't and I have an MD, that doesn't qualify me to see kids.
That's right.
Right?
You can't just walk into the office one day at a hospital and
Right.
just do that.
I mean, can I deliver a baby on a plane? I could. I mean, I trained in obstetrics
100%.
gynecology, but I'm not going to open an obstetrics gynecology clinic.
That's right.
And I think vice versa for psychology, someone who works in consumer psychology, or at least trained in consumer psychology, but found it, it's maybe better off to open a clinic and see patients. You have to be careful. So you choose the person who's qualified, and you go to them, and they'll direct you to the right person, because often you don't know, as you said, is this a
Yes.
serious mental illness that needs to see a psychiatrist for medications, or does this need therapy? But a well-trained clinical, or even sometimes counseling psychologist,
Yes.
and a well-trained psychiatrist knows what you need. I'll give a good example. An orthopedic surgeon may, if you have a knee problem, look at your knee, image it, and say, you don't need surgery. I might give you some medications. And you need to see a specialist in physical medicine,
Right.
Which is different than physiotherapy, by the way. In the field of mental health, you have people like orthopedics, you have people like physical medicine and rehab, you have people who work in physiotherapy, you have people who work in sports, and that would be like psychiatrists, psychologists, psychiatric nurses, TMS technicians, psychometricians. That would be the whole kind of multidisciplinary team.
I can imagine, but okay, so makes sense. But Dr. Abdullah, how do we find the right professional for us that are actually qualified, so that we don't go through that mistake you just mentioned, Dr. Mohammed?
Yeah. So, to be honest, I think this is a loaded question, I would say, and I'll try to be careful with how I answer. I would say a lot of the times, your best go-to at this point, and then the situation we're at, is ask the doctor that you see, whatever doctor that you go to. So if you see a dentist, if you see a GP, and you think you need someone to help you in terms of mental health, they would be a very good first indicator. Medical health professionals, they tend to know each other. They tend to know who's qualified. They tend to know who's good. They tend to know who did well even in their schooling. They know each other, most of the time.
That's true. Tight community.
Yeah, especially the people that went to medical school together. They know each other, and they will give you a very good recommendation of where to go or who would help you best. And then also in terms of, if you're looking for a psychologist, you would also ask. They would know also who's a good psychologist to go to if you needed that services. But as Dr. Mohammed was telling us before, or letting us know about how to find the most qualified person, and making sure you're going to someone that isn't just having an interest in the field.
Right.
This is an important aspect, because having an interest in something, as he said, does not qualify you to do it. If I'm interested, I for one, I'm very interested in, and I do see that. I like seeing surgical procedures.
Okay.
I'm not going to walk into a hospital tomorrow and perform a surgery, even though I like it. I see it and I find it fascinating, but I won't go in. Nobody would want to come do a surgery under my supervision.
Yeah, people would be a bit scared.
That'll be a very unprofessional way of I wouldn't even know how to approach it. I have an idea about it. And I think this is something that we have to be aware of, who we are talking to in terms of professionalism, who's licensed, and if they're qualified to do what they do, or they're supposed to do, but what they're claiming they're doing.
I think people need better health literacy, and I think this should be even taught in schools. For example, in the United States or Canada, you immediately can go to, I lived in Ontario for some time, which is one of the biggest provinces in Canada, where Toronto, that's where I trained. So you could go, if you're a patient and you want to make sure your doctor is licensed, you can go to the website of the College of Physicians and Surgeons of Ontario, put in your doctor's name, and it immediately show their training, their license number, where they trained, if they ever failed, if they ever had complaints against them, and so on. Now, it's harder to do here, but you can actually, when you meet the doctor, say, can you tell me a bit about yourself, where you trained? There's nothing wrong with that. We sometimes feel shame about that, but
Yes.
I mean, you're putting your life or your mental health in someone's hands. It's not wrong to say, can you tell me where you trained and what qualifications you have and what areas you're expert in and what areas you would refer to a colleague.
Yeah.
I wouldn't be upset if someone asked me that question, and I would answer them honestly.
Yeah.
Definitely,
Yeah.
and I think it's really important for patients to know, because as you said, you're actually going to have a relationship with the doctor where you're seeing the doctor, you need to trust the doctor,
Yeah.
and you're putting your life and mental health in their hands. So sometimes we need to get over our shyness and do ask direct questions.
Yeah.
So Dr. Mohammed, what are some difficulties that you do face with your patients? Because I understand working with patients all the time, things could get a bit hard.
I think the biggest difficulty we face in Kuwait and probably in a lot of Eastern societies, it's all over the world, but especially in Eastern societies, is shame and stigma around mental health issues. So one of the biggest issues is people having misconceptions about mental health, coming too late. You know, we know that early treatment in so many areas of healthcare leads to better long-term outcomes, whether that's diabetes or heart disease and even mental health. And sometimes when patients come way too late, it takes a long time and it takes a lot of effort. It may take more, doses of medications or brain stimulation or more therapy to get them where you could have gotten them had they come 7 years earlier or 10 years earlier.
Definitely.
The other thing is, once you actually say, okay, here's the plan of action, I need you to do therapy. Some people have shame around speaking about their problems. They worry a lot about their privacy. Or if you say, I need you to take a medication, they're worried about this medication is going to get me addicted. Will I ever come off of it?
Yes.
Are people going to say I'm crazy? So that's, I think, one of the biggest difficulties in working in mental health. One time I was giving a talk to medical students and I was telling them, psychiatry is one of the most difficult specialties. And they said, oh, it's not brain surgery or cardiac surgery. I said, psychiatry is the only specialty where you constantly have to explain to your patients that your treatments are okay to take.
That's right.
Imagine if I was a diabetologist and I said, here's your insulin. Don't be ashamed about it. It's okay to take insulin.
You're fine.
But we have to do that every day with patients. And I'm not complaining about that. I've chosen this profession. I'm very proud to do it. But I would say it is a challenging part of the profession.
I totally agree with you, because I think all of us grew up knowing that medication is not okay when it comes to mental health.
Yeah.
You're going to get addicted, and that's a massive stigma around it.
Yeah.
And I've personally met people that would have done way better in life way sooner if they actually listened to their doctor and took their medication.
Yeah.
So I think that's a big issue. And another thing that I've noticed is confidentiality.
Yes.
A lot of people constantly ask about that. Whenever I recommend a doctor to a friend or anyone I know, it's always, will they tell someone? What if someone goes and asks? So I think that's also important to mention, the confidentiality part.
Yeah, I think in the field of mental health and psychiatry and psychology, privacy is one of the biggest and most important thing for us.
Yes.
We do not discuss and talk about anything a patient says unless it's with the other team member with us in the team that is seeing that patient.
That's
like,
right.
for example, Dr. Mohammed will never come and tell me about a patient he's seeing that they're not seeing me at the same time.
Of course, yes.
We would never talk about that unless it's a very, very interesting case and we're learning from it, but we would never mention names.
Of
We
course.
would never mention anything. We'd just talk about it as very, it's like
An academic
an academic study
For
that we're
sure.
looking at,
Yeah.
and just for training purposes or to discuss or to seek at like a different point of view.
And that's within the clinic, let alone
Yeah,
outside the clinic.
exactly.
right,
So
yeah.
outside the clinic, we
Definitely.
would never talk about it. We make sure that that's a big important aspect of patient's care, because when the patient sees that we're taking that seriously, they're more likely to trust us and believe
For
that
sure.
we're there to help them, and we won't. And Kuwait is a very small community.
Yeah.
Everybody knows each other in some way.
Yeah.
And when they see that we're very strict with that and we do not break that for whatever reason, and when we do that even within our colleagues within the professions, it's even more strict outside my colleagues. Like
Of
if I won't
course.
even open a discussion about a patient that isn't seeing Dr. Mohammed, and for me, I will never even bring it up to a friend. And this is someone
That's
that
true, yes.
yeah, so this is a very important thing that we sometimes find difficulties with, that sometimes the patient would come in and the first thing they would say is this confidential?
That's
They
right.
already have this mindset that possibly it could not be confidential. And this is something we do.
We really take it to an extreme, and we didn't invent that. I mean, this is how we trained. I remember the hospital I trained in, they had plaques in all the elevators. It was a huge hospital.
Oh, wow.
It's Toronto General Hospital is one of the biggest hospitals in Canada, and it had everything from cardiac transplant to psychiatry. And there were plaques in the elevators saying, remember not to discuss your patients. Because sometimes you're going from floor to floor, you're seeing
That's
some patients on this
right.
floor and your colleagues are with you and you're discussing the cases you just saw. It was just reminders not to discuss it. When I go to a mall in Kuwait, and as Dr. Abdullah said, it's a small society, sometimes I'll see someone who's a patient. I don't say hi. I don't even
Okay.
wave from far away. Because, and then I remember a patient once came to me in the clinic and said, I saw you and you saw me and you didn't say hi. I said, I did that on purpose because if you come say hi to me, that's okay.
That's true.
But I don't want to say hi to you and put you in a position where you have to explain how you know me.
Yeah.
Right?
That's right, because a lot of patients might be going to therapy, but people around them have no idea about it. So I think that's really great, and I'm glad you mentioned that, because I can imagine how hard it would get having to reassure your patients all the time that medication is okay and this is confidential.
Yes.
I think an important part that Dr. Hamid was telling us before about in terms of having people that aren't qualified, which was an additional thing to difficulties we find with treating patients, is that sometimes a lot of patients end up going and seeking help from non-specialized people. And they come to us already when they've already went some sort of treatment plan that we look at and we're like, what happened?
How is this?
Well, it's like this isn't something that that we're supposed to fix rather than treat. So we have to first go through fixing everything that happened, and then treating again from the start. And as something that to us is very shocking, that why someone would rather go to every other profession than coming to us. And they would see their GP. Then from the GP, they'll see a neurologist. Then they'll see an internal medicine. Then they'll see everybody in the spectrum.
A faith healer.
They'll see everybody.
And
we're the last
they'll
resort.
Take up yoga.
Well, we are the last resort when everything else has failed.
That's right.
When everything has failed, they're like, might as well try these guys. You know,
finally.
There's nothing I would lose. Everything else has failed. And then now we try to work with years of them having already negative thoughts about their condition and about how things are not helping.
That's right.
And now we have to try to make do with what we can. But I think another thing is this awareness of who can help me. And I think a very important thing that, and this is not to kind of in any way discriminate or push them aside, is this phenomenon of we see is of life coaches coming up.
Right, a lot of them, honestly, especially on social media.
And a life coach is an important profession within the spectrum of what they're doing.
Yes, that's the key point.
Within,
you know, it's like what we were saying earlier, that I wouldn't deliver a baby on a plane and you wouldn't do surgery. So a life coach shouldn't be doing psychotherapy. Because you know, sorry to interrupt, but psychotherapy actually done wrong can have as bad side effects as giving a wrong medication.
For sure.
Because if you open up a trauma and you don't know how to close it, you don't know, you know, you can speak more to that. I'm sure you've seen cases like that.
We see patients that we ask them, have you seen a therapist before, or have you done therapy? And their response to us is, I've seen a life coach.
Right, and that's definitely not therapy.
And that's not therapy, and a life coach should, they're not licensed as a medical healthcare professional in any format. They're not a healthcare professional or a mental health care professional. They're not licensed, they're not regulated. And I think what I say, could people might assume that we're attacking them. We're not. This is, it's like me saying an accountant is not licensed or but an accountant wouldn't be upset when I say that.
You're just highlighting their frame of work, just like you just highlighted your frame of work.
And if they stay within their frame of work, they can help people out.
Exactly, and it could be a great collaboration. They could be coaching hand in hand with therapy and also seeing a doctor.
Because sometimes a person would want or need to see a life coach for example, they're having life difficulties, but it is not impairing. So they don't need to see us.
Or they need to organize their life, organize their priorities. I mean, a life coach could probably do that better than anyone.
Exactly.
You know?
They don't need to see us, and that's a very good place for them. And but in terms of, to me, what I would say, if a person is having any kind of health condition, whether it's if it's a mental health condition, at that point, a life coach should not be seeing anybody that we would put under the title of a patient. If it's somebody that has a condition, they should be referring to someone else. We tend to even see some life coaches telling, and this is what we end up having to discuss, me and Dr. Hamid at the clinic, is we see some life coaches telling patients to get off their medication.
Which I think should only be done by their doctor who prescribed the medication in the first place.
And I think that's the saying. If you can't prescribe it, you can't tell them to get off it.
Exactly.
Because there's ways to get off the medication. I mean, patients come to me all the time and they tell me, I want to come off my medication. And I think it's a bad idea. And I tell them, look, I think it's a bad idea because this, and this. And they say, I disagree. I want to come off the medication. You know what I do? I tell them how to get off the medication safely, even if I disagree. Right?
I'm guessing it's gradual. Right?
Well, it depends on the medication.
Right.
Sometimes actually gradual worsens things, right? So it really, I mean, different medications have different ways of coming off. So some medications you need to be on a period of another medication while you're coming off for a week or two.
That's very complex.
Right, and what if you come off your medication very quickly and it's affecting the levels of other medications, like your heart medications and so on? Sometimes you need to adjust levels. So you need someone very aware of that. So sometimes patients are afraid to come back to their doctor and saying, I want to come off, because their doctor is going to say no. Look, I'll tell you, even if we say no, I don't think you should come off. If you insist, I will help you come off safely. That's my obligation to you.
That's right, because a patient can just go home and simply throw the medication away, and that's not doing any help.
Exactly.
At all. And for a life coach, or sometimes we see, rarely we see this, but nutritionists saying, you know, come off your medication. I mean, what they should be saying is, why don't you go back to your doctor and discuss coming off your medication?
Right.
And even if they have a belief against the medication, why don't you insist that you come off your medication with your doctor and let them do it safely? I would be okay with that.
Of course, I can imagine, because yes, sometimes medication does alter our appearance, since you mentioned nutritionist, but mental health comes first, and then we can deal with how much weight we gained or lost. For sure. Dr. Abdullah, finally, do you have any advice for our viewers on mental health in regards to their mental health?
So I think an overview of what I've been saying always is, and I even quoted my colleague here, which is with us today, is that if you ever thought about you need to see a mental health professional, go see a mental health professional. There is nothing bad that would come out of it.
You don't lose anything.
They either confirm that there is possibly something that they need to help you with, or they tell you there's nothing wrong, and you're worrying, what you're worrying about is nothing that we need to be treating.
That's true.
And that in itself is reassuring.
That helps you know that, you know, that's a good, I would love to go to, when I have any concerns, and my primary caretaker or my doctor, whoever is seeing me, tells me what you're worrying about is nothing.
Exactly.
It's all good.
And the worry goes away.
And that's
a
lot. Exactly. A lot of your worries is like, oh, thank God, I don't have that. And that is an important thing, is that if you feel that there is something that even for a second that's bothering you, go talk to them. And they will never tell you. We will never try to dig around to make sure that you leave with a diagnosis. We sometimes, like as Dr. Hamid says, that we sit together a lot of times after every day and we discuss complex cases. We sometimes try to remove possibly of us overthinking and trying to fix a diagnosis someone, because a lot of the aspects of mental health are part of everyday life.
That's true.
The anxiety is part of everyday life. Depression is part of everyday life.
We experience it.
We have it.
Definitely. I think all of us do with our lifestyles now.
So it's important that people aren't afraid, and they don't think of it as a taboo subject, and don't think of the stigma around it, of using a lot of the mental health terminologies as insults, telling someone did you take your medication? Did you take your medication? Or saying someone, oh, you need to go see a psychologist, or you need to see a psychiatrist.
That's right.
Hinting at that you're not stable. And this terminology is really affecting us as trying to bring awareness and trying to make it more acceptable for us to go see mental health professionals.
For sure.
And I guess the last point from my side is that make sure whoever you're going to see is qualified. I have no issue somebody coming in to see me day one and telling me, they can say it as blunt as this: prove to me you're qualified. If they say it as blunt as that, people won't say it, but if they do, I have no problem explaining to them how I'm here and I'm qualified to help them. And if they don't think that I am, then that's okay. Then that means I wouldn't have been a good fit for them.
Exactly.
So to me, it's never going to be an offensive thing. I'm never going to be upset if somebody asks me that.
It's their right.
It's their right. If I go to someone that's going to do any kind of procedure on me, and I ask them, what makes you qualified to do that? Or are you specialized in that? Are you trained in that? And they tell me, yeah, I did a random, I'll be like,
I did a 1 week course.
Exactly.
I saw a YouTube video. You know, I would run
instantly.
I would run.
And that shouldn't be any issue.
Yeah, I think this is something that we should be aware of. Who's qualified?
Exactly.
That's right.
Yeah.
Dr. Mohammed, Dr. Abdullah, thank you so much for being with me this evening. It was my absolute pleasure. Thank you.
It was nice seeing you. Thank you.
Thank you. Dear viewers, we had with us Dr. Mohammed Alsuwaidan, consultant psychiatrist and founder and clinical director of Mindwell, and Dr. Abdullah Habib, doctor of psychiatry and director of clinical neuropsychology at Mindwell. And up next, we have a report. Stay tuned for that.